Welcome, everybody. Good morning. Our panel this morning is on reducing medications on our elders. And it's such a really important topic. So Donnie's going to start, and this is Donald Yance, who you all know by now, and Kenneth Proefrock and Mary Rondeau. So I will let them start now. Thank you. And you can go over a few minutes if you have to, because we have a break for lunch next.
Thank you, Linnea, and good morning to everyone. It's so nice to see everyone. This is a very big topic, and I wish that we had 3 or 4 hours to talk about it. Personally, this is pretty much makes up most of my personal practice with patients, is weaning people off medication. My first big success with a patient was about 35 years ago, a man named Saul Schulich, who had heart disease and was wheelchaired into my office. And he came with his 2 daughters. One was a physician herself, and he had suffered a severe heart attack, had cardiomyopathy, congestive heart failure, and I reviewed all his medication, put him on a protocol, but the thing I think that made the significant difference was cutting his medication down. There we go. So here you can see. So some of the common medications that I work with to get people off of that I think are way overprescribed and have way more harm than people are led to believe. Number 1, PPIs. Proton pump inhibitors are so damaging. They're the hardest drug to get people off of. I'd rather get people off of opiates than PPIs, but I can do it, and I do it.
It's interesting when you take a dive into the literature and you look at classes of medications like SSRIs, and usually most of the studies select out for 65 and older. And so most of the studies that actually look at the efficacy of, like SSRI medications don't even include that population. Yet it is, the primary treatment for depression in our aging adults. And so there's clearly a big disconnect there.
What they're saying is exactly correct, that polypharmacy is a huge problem, not everywhere in the world, but definitely in North America. And this particular diagram, we're talking about Canada and the United States, and we're looking at people who are from the ages of 40 to 79, who are using 1 or more and 5 or more prescription drugs in the past 30 days. Oh, okay. I'll do this. All right. Okay, our first question that has arrived to us is, do you have any sources for a good antihistamine diet? Well, there's lots of lists on them on the internet, and every once in a while they'll work for somebody. Or the person usually knows what's giving them the trouble. If we start them with something that's a mast cell stabilizer, like just quercetin, 3 times a day, now that'll eliminate a lot of the minor histamine players. So now you can take a look at what the big ones are.